Dr. G.
Hi.
Hi, nice to see you.
Nice to see you too.
So one of the areas you focus on in your practice is fertility,
Mm-hmm.
which is a really important topic because so many women and men, whether it's recurrent miscarriage or whether it's unexplained infertility, can you talk a little bit about your approach, your practice, and how you support those individuals?
Yeah, so I think the very first assessment is really figuring out like what the journey has been to where they're currently at. So, is it the, situation where we're dealing with miscarriage or that they've never been able to get pregnant or that they're getting ready for an assisted reproductive technology cycle. So trying to figure out exactly what's been tried and where they're working towards is really the first step. The next step is really to do some very foundational investigations as to like root cause drivers as to why it may be more difficult to successfully getting pregnant. So it's usually just looking at our root cause medicine matrix from functional medicine. So taking a look at lifestyle practices, metabolism, immune system dysfunction, detoxification pathways, any type of mitochondrial dysfunction as well, any inflammation. And then we essentially create a hyper-personalized care plan based on those findings. Oftentimes, it's really a mixture of some metabolic pieces that we need to address, so whether that's weight management, insulin resistance, such as in the case of PCOS, but it could also be something as simple as just elevated oxidative stress and elevated inflammation. Once those more foundational pieces are taken care of, then we start to get into the more, I would say, advanced and nuanced interventions where we're starting to, really consider any autoimmune triggers as to getting in the way of getting pregnant. We also want to really focus on any hormonal imbalances that we need to address, or maybe, kind of control with more higher force interventions such as medications. Ultimately, the goal is to kind of create a care plan and a care team that supports their goals, which sometimes involves having a relationship with a fertility clinic too. So work really closely with fertility centers and fertility doctors, endometriosis surgeons, OB-GYNs to make sure that the comprehensive care plan is really taken care of for the patient and they don't have to do a lot of that work on their own.
I love that. So one of the questions I would have is around mitochondrial support, which you mentioned, and this being so foundational. Could you maybe explain a little bit about the difference between egg quantity and egg quality and how the mitochondria, and what is the mitochondria and why does that play a role in that foundational piece of hormone regulation and how people conceive and what the development process is for the egg?
Yeah, so egg quality and egg quantity, they can go hand in hand as we start to think about age being a contributing factor or environmental stressors contributing to difficulties getting pregnant. But in specifically referring to egg quantity, we typically think about that more on a time scale. So depending on what your age is, we then start to become more concerned about the number of eggs that are viable for becoming fertilized and getting pregnant. The unique case with that is premature ovarian insufficiency, where we're starting with a lower number of eggs fairly sooner in life. And really what the other health implications are for that in regards to the protective benefits of estrogen is really important to investigate as well. For egg quality, really lifestyle, I would say, is the biggest piece when we start to think about egg quality. So really, what toxins are you exposed to? What are you eating on a regular basis? How are you managing your stressors? How well are you nurturing your relationships? Those are the big factors that really contribute to impacting egg quality. The big factor for that is really the mitochondria. So just egg division and egg development is a super energy dense process. And so the only way we're able to fuel that is really having the mitochondria being really well supplied with building blocks, and then also having a good detoxification process to make sure that they're not building up toxins through this energy process as well.
Well, my question was maybe like, what kind of toxins should the average couple, but we're talking about women, of course, specifically when thinking about eggs, is what kind of toxins should we be most aware of that we might encounter on a regular basis?
Yeah, so one of the most common ones is really any type of personal care product. So if you think about anything that you're putting on your body, whether that's makeup, laundry detergents, any lotions or body washes that you're also using, but we also want to take a look at period products as well, right? The toxins that are in, tampons, pads, or menstrual cups that you're essentially exposing to your mucosal surface that can contribute to toxin exposure too. And that's really where the lifestyle piece also comes in. Like, how are you preparing your food? Do we need to be mindful of things like plastics or processed foods as well? And then work hazards, right? We have plenty of patients that work in a variety of jobs that may expose them to some chemical exposures at work, or even, work stressors can also be a toxin as well.
It's like, can we avoid plastics? Like, in reality, I mean, I constantly am thinking about this, but like, they're in everything. Even, now glass water bottles, the cap that lines the water bottle, it has a plastic cover, and like that's exposing us. So, I mean, how do we minimize that? And like, what is this thing called, estrogens that people talk about, and how is that impacting the fertility, and why is plastics and some of other chemical products, why is that interfering with folliculogenesis, the process of egg development?
Right. So the short answer is no, you can't avoid plastics. It's within everything that we consume in our bodies. It's how we hold anything, right? Any type of fluid or liquid or product. And even if you try to minimize it, it's probably coming up in some of the manufacturing processes that are producing that product as well. So my approach is to really focus on the detoxification of it. So you can not avoid exposure to plastics, but you can absolutely support your detox processes as appropriately as you can. So that's making sure that you're going to the bathroom regularly and having regular, easy to pass bowel movements. That's also making sure that you're sweating, whether that's through sauna or moving your body regularly, making sure that you're eating a really phytonutrient diet, and making sure that you're getting all of the building blocks just from food that you need to support your natural detox processes, particularly in your liver. And the mechanism is really based on this idea of xenoestrogens, or these chemical like estrogen structures that help kind of, or essentially bind to the same receptors that our estrogen does in our body. And it causes these aberrant fluctuations in our hormones that makes it essentially just really hard to predict when is the best time to have sex and get pregnant. And we need a really predictable cycle to really help coach our patients about when is the best time to try to get pregnant. So that is really the piece that becomes the most bothersome once we start to think about exposure to chemicals and toxins.
Okay. 5 top detox foods.
Oh,
go.
Milk thistle. So that's one of my favorite herbs, particularly for supporting liver health. I'm going to kind of cheat and put in glutathione and NAC in the same bucket. So really important for phase 2 detoxification. NAC is also really helpful for reducing ovarian endometriomas. So particular, condition close to my heart. Sulforaphane is another one that I really like. So you can either get it from a supplement, but one of the best food sources is actually broccoli sprouts or cruciferous vegetables. So in regards to getting a food detox support, that's my favorite one. A tip that I typically use is you want to chop up any cruciferous vegetables into the smallest pieces possible, let it sit there, and that actually helps to activate the active ingredient there to help with detoxification.
That's a great tip. I love that. Yes.
Dietary fiber is critical. So just to make sure that you're having regular bowel movements, also helping to bind things in the gut as well, also feeds into the estrobolome, which is your microbiome in your gut that helps with making sure that you're actually getting rid of excess estrogen and not recycling it back. And then a third detox supplement. Magnesium is actually one that I particularly love. So it's a cofactor that's particularly useful for a lot of detox mechanisms in the liver, and also helps with bowel regularity as well.
You mentioned glutathione. And in my practice for years, as you know, I've used glutathione as a way of supporting phase 2 liver detoxification, which we talk a lot about in functional medicine, but also supporting reduction of oxidative stress.
Yes.
Do you mind just defining oxidative stress and how that is a common component that we see in a lot of fertility conditions?
Yeah, so oxidative stress, the simplest equivalent I can think about it in layman's terms is essentially like rusting of your cells and tissues. So it's this exposure to oxygen in a way that kind of ages the tissue in a way. And so what we try to do is we try to combat that by providing our body with antioxidant nutrients and also upregulating our endogenous antioxidant pathways.
So what we produce on our own.
So glutathione we actually naturally produce in the body, and that's why NAC, which is a precursor for glutathione, can be a helpful helpful way to support your own glutathione production. For individuals where oxidative stress is just rampant in their body and we actually need a little bit of a boost, glutathione is just the end product for a way to supplement. There's also some genetic variations that make it difficult for people to produce their own glutathione, so it can be a way to bypass that as well. And what's interesting is the mitochondria are a pretty consistent source of oxidative stress. And because we're thinking about this really energy dense process in regards to building another human being, managing oxidative stress is quite critical for that process when we know it's likely going to happen anyway.
Thank you for your insight.
Thanks for chatting with me.
I appreciate you.
You too.